Hello, this is the charting orientation video for how to do a Soapie Note with Hallway Healthcare. You'll be going to hallway.devero.com. This will bring you to the login screen and log in. You'll be doing a Soapie Note for test patient for orientation purposes. And then you'll be going to Soapie Note. Soapie Notes are to be done every 2 hours on your shift. So if you're working from 7 a.m. to 7 p.m., then so you'll be doing a Soapie Note from 7 a.m. to 9 a.m., 9 a.m. to 11 a.m., 11 a.m. to 1 p.m., and so on. So this will be our first Soapie Note of the day. So 7 a.m. to 9 a.m. For Soapie Notes, you must chart only to the patient's covered condition. You'll find the covered conditions not only in the patient profile, but at the top of every Soapie Note. So these are the patient's covered conditions. You cannot chart on anything other than these 3 covered conditions here. So if it was a patient that only had 1 diagnosis, like a malignant neoplasm of colon, you cannot chart on anything but relation to the malignant neoplasm of the colon. So let's get started on this Soapie Note. So we'll just say patient coughing with audible secretions, because that's what I observed. I heard him coughing with audible secretions. Or I could even say what the patient said. Patient states, I can't get rid of these secretions while he's coughing up. So it's either something that the patient states or what you are observing. Objective for eligibility. This is for objective data only. The patient's diagnosis does not go in this box. This is going to be the signs and symptoms and your assessment of the problem. So if you clicked eligibility, it brings you to all these nursing diagnoses. So these are ones that have already been opened. You're more than welcome to open up a new one to see the entire template before it is touched by another nurse. And you can do that by going to Insert from Template and choosing your nursing diagnosis for this situation. So these are all nursing diagnoses and care plans that you can choose from. So since my patient is having audible secretions, my nursing diagnosis is going to be ineffective airway clearance. Here it is. And these are everything that could be a problem for ineffective airway clearance. So what I'm going to do is I'm going to select it and insert it to eligibility. And there it is right here. Going on from here, if you double click inside the box, then you can take out everything that does not pertain to your patient. Please do not leave this like this and put it inside your template, because I find it very hard to believe that your patient is experiencing all of these at the same time. So I'm going to delete everything that doesn't pertain to my patient. Okay, so abnormal breath sounds, crackles, rhonchi, wheezes. Yes, my patient is having wheezes. Abnormal respiratory rate, rhythm, and depth. So I'm going to put respiratory rate 21, uneven and labored. Dyspnea, excessive secretions, inability to remove airway secretions, ineffective or absent cough. So I'm going to delete or absent because he's having an ineffective cough. So now that this is correct for my patient, I'm going to insert it, make sure it's correct, insert it to the form. Make sure it's the only one highlighted blue. And there it is. For assessment and prognosis, it's the same thing. This is the nursing diagnosis or conclusion of the problem. So I have a note here. For subjective, going back, it says right here, patient statement of problem or what you're observing. Objective, this must be objective data only. And then your assessment. It's the patient diagnosis, covered condition, related to, as evidenced by your objective data, doesn't have to be all the data, but choose 1 to 2 objective data, secondary to the patient's covered condition. So I'm going to go back to my Soapie Note, and I'm going to choose my ineffective airway clearance again, because that is my nursing diagnosis. I'm going to insert this to template. I'm going to double click, and I'm going to get rid of everything that doesn't pertain to my patient. So ineffective airway clearance, that is my diagnosis related to. I need this. And so what is it related to? Airway spasm asthma. He doesn't have asthma. Well, he may have asthma, but it's not his covered condition. Copious or tenacious tracheobronchial secretions. Yes, he is experiencing that. So I'm going to delete these little underscores. Decreased energy and fatigue. Yes, he's experiencing that. Impaired respiratory muscle function. Yes. So I already have 3 good ones. I'm going to delete the rest of them. And even though right here it says stroke, even if your patient did have a stroke, that is not part of their covered condition, so you must not document on that. So again, I'm just going to get rid of everything and go to my as evidenced by, which is right over here. Delete. And so what is it as evidenced by? 1 to 2 objective data. So my objective data is he's having abnormal respiratory rate, rhythm, and depth, and also he has copious amounts of secretions. So I'm going to state as evidenced by respiratory rate 21, uneven, labored, and excessive secretions, clear and white in color. Secondary to accepted condition disease process. This is your patient's covered condition. What we talked about is at the top of your Soapie Note. So that's what you need to put in here. So this is, as you saw at the top of the Soapie Note, he has 3 covered conditions. He has malignant carcinoid tumor of the bronchus and lung, and he also has diabetes 2, or type 2 diabetes mellitus with diabetic polyneuropathy. So this Soapie Note that I'm doing has to do with his malignant carcinoid tumor of the bronchus and lung. So that's why I'm only putting this diagnosis at the end of my sentence. So let's review this. Ineffective airway clearance related to copious and tenacious tracheobronchial secretions, decreased energy and fatigue, impaired respiratory muscle function as evidenced by, here's my objective data, respiratory rate 21, uneven, labored, and excessive secretions, clear and white in color, secondary to accepted condition disease process, and there's my covered condition. I'm ready to insert this to my template or into my form, and there it is. Goals. You only need 1 goal. So again, I'm going to go to insert from template, ineffective airway clearance, and here's all the goals. Select it, insert template to goals, double click, and you will see that there's 1, 2, 3, 4, 5. You only need 1 goal. So I'm going to select the best one. Patient will maintain clear open airways as evidenced by normal breath sounds, normal rate and depth of respirations, and ability to effectively cough up secretions after treatment and deep breaths. That's a great goal. I'm going to delete the rest and insert this one to my form. Interventions. You only need 1 to 2 interventions. Ineffective airway clearance. And here's all of the interventions. There's many, many, many interventions. So, and they please do not need to be long. So just select 1 to 2 great interventions that you're going to be performing, not just any interventions, but the ones you actually will perform. So I'm going to auscultate lung sounds. And I'm also going to administer a breathing treatment. So I'm going to see if there's an intervention for that. Give medications as prescribed. There's also suctioning in here if you will be providing suctioning. It looks like that was the only medication one, so I'll go ahead and select that. If I can find it now. Here it is. Okay. So those are my 2 interventions. They are highlighted. So I'm going to insert them to my form. And now it's time for the evaluation. So in the evaluation, you just state what the problem was, what you did, and what was the outcome. So here's other notes that will be provided to you. So state which interventions you performed and the patient outcome. This must be sufficient documentation on what you did as a skilled nurse for the patient and the patient outcome. Note, interventions you perform need to match what you've stated in your intervention section. So going back to on what you did as a skilled nurse for the patient, you need to document why a skilled nurse is needed to perform these interventions. So if you state something that a CNA or home health aide could perform, it's not sufficient documentation. It needs to be why you as a skilled nurse are there performing these interventions and monitoring the patient. So for my evaluation, I'm going to state skilled nurse administered breathing treatment per MD order. Lung sounds clear to auscultation after breathing treatment. Lung sounds clear bilaterally in all fields. After breathing treatment. Okay. So respiration decreased to 17. They are even and unlabored. Patient able to effectively cough and expel secretions. Secretions clear and white in color, no foul odor noted. So even just that is enough sufficient documentation. It states what you did, you administered the breathing treatment, what his lung sounds sounded like after the breathing treatment, and then what his respiratory rate was, and the rhythm and depth after the breathing treatment, and the patient was able to effectively cough and expel secretions, and the secretions were white in color and no foul odor noted. So this is a sufficient Soapie note for an effective airway clearance. When you're done with your Soapie note, you can either save it or you can send it to the office. If you're done with it, you can hit send to office. So here are some more examples of Soapie notes. This is for, this kind of lays out what goes in every box. So you're going to want to spell everything out, you know, just like AEB, as evidenced by, etc. Just please spell everything out that you can or can remember to spell out. You're only going to chart to patient's covered condition. Here is the covered condition. So, you know, you're not going to be documenting about neck pain if the patient's covered condition is malignant neoplasm of the rectum, because his neck pain has nothing to do with his malignant neoplasm of the rectum. So here's the subjective. This is one option, this is another. Patient had bowel movement, or you can say patient states, I had a bowel movement. So one of the nursing diagnoses for this patient because of malignant neoplasm of the rectum is risk for bleeding. So here's my objective that I have. Patient is at risk for bleeding, gastrointestinal disorders, cancer of the rectum. Patient displays nonverbal signs of pain, grimacing when having a bowel movement, or when skilled nurse provides perianal care. This is only for objective data, so you're not going to state the patient's diagnosis in here. Assessment, prognosis. This is your nursing diagnosis statement, so it must follow this template. Your nursing diagnosis, which is risk for bleeding in this case, related to, secondary to, accepted condition, disease process, malignant neoplasm rectum. So when you're doing risk for, it doesn't have to have as evidenced by if you have nothing as evidenced by, because you're monitoring for the risk of bleeding. So my assessment states risk for bleeding related to disease process, surgery, secondary to accepted condition, disease process, malignant neoplasm rectum. Goals. So you only want, for the plan, you only want one goal. So risk for bleeding goals. Patient does not experience bleeding as evidenced by normal blood pressure. Okay, so since my goal says normal blood pressure, I want to make sure that I'm monitoring vital signs, and especially blood pressure. So here's my 2 interventions for risk for bleeding. Assess skin and mucous membranes for signs of petechiae, bruisings, hematoma formation, or oozing of blood. I'm also going to be monitoring patients' vital signs, especially BP and HR. Look for signs of orthostatic hypotension. Hypotension and tachycardia are initial compensatory mechanisms usually noted with bleeding. So in my evaluation, I'm going to state what interventions I performed and the patient outcome. Note this also matches the interventions I selected in my intervention section. Skilled nurse provided perianal care and assessed anal area for bleeding. Assessment, skin intact with no signs of tearing, no inflammation, no hematoma formation. Redness noted, no bleeding, no signs of bleeding. Skilled nurse assessed vital signs. BP 120/80, heart rate 70, respiratory rate 15, temperature 97.7 degrees Fahrenheit. O2 sat 99% on room air. Skilled nurse will continue to monitor for signs and symptoms of bleeding. And you will have these examples to be able to print out. Here's another one for the same cover condition. So you have 2 options here, what you can state, or whatever else. These are just examples of what you can use. Patient states, no, I do not want that, when skilled nurse offers electrolyte replacement fluids, or patient is refusing to drink adequate amount of fluids, or patient has watery stool and diarrhea. So this one I did on risk for electrolyte imbalance because of diarrhea and watery stool. So risk for electrolyte imbalance, objective data. This is for objective data only. Again, you're not going to state the patient's diagnosis in here. So my objective data is I'm observing fatigue, watery stool, and the patient is refusing fluids at this time when I offer them. My assessment prognosis, risk for electrolyte imbalance nursing diagnosis. Here's my nursing diagnosis, risk for electrolyte imbalance related to diarrhea as evidenced by patient stating, no, I do not want that, when skilled nurse offers electrolyte replacement fluids secondary to accepted condition, disease process, malignant neoplasm rectum. So again, I have as evidenced by in here because he's saying, no, I don't want that. So if you don't have as evidenced by, that's okay, because this is a at risk for. So if this was something like impaired breathing, then it wouldn't be at risk for, so you need to have an as evidenced by. So this one I did put as evidenced by, but for risk for, you do not have to have as evidenced by. My goals, my plan and my goals, I only have one goal here, which is only one goal is needed, please. So risk for electrolyte imbalance goals, client will display heart rate and blood pressure within normal limit for the client, absence of lethargy and confusion. Okay, so my interventions, only choose 1 to 2 interventions. I chose encourage electrolyte replacement fluids and monitor intake and output, calculate fluid balance, weigh client daily. So my evaluation, skilled nurse provided education on high fiber diet to promote formed stool and encouraged electrolyte replacing fluids, 20-minute post-skilled nurse education. Patient agreed to drinking fluids. Patient consumed 250 milliliters. Patient weight today, 155.7 pounds, no change from last visit. Patient displays signs of normal heart rate 74 and BP 120 over 80. Skilled nurse will continue to monitor for signs and symptoms of electrolyte imbalance. Okay, and the last one we're going to go over as an example is impaired tissue integrity. So here's two examples of what you could put in your subjective. Patient had bowel movement, or patient grimacing trying to change positions in chair. These are two different ones for impaired tissue integrity. Impaired tissue integrity, my objective data. So the affected area is tender to touch. Damage or destroyed tissue, stage 1 pressure sore to coccyx. Local pain, reports pain 4 out of 10. If you're stating pain in the objective, you need to put the numeric level or the nonverbal signs of pain, grimacing, moaning, etc. Protectiveness towards sight, and skin and tissue color changes. If you're putting skin and tissue color changes, you need to select or state what color the tissue color changes are. So again, this is for objective data only. Do not state the patient's diagnosis in here. Assessment prognosis. Impaired tissue integrity related to fecal incontinence, prolonged sitting in chair, damage or destroyed tissue as evidenced by. I'm going to put in here 1 to 2 of my objective data. So here's one, as evidenced by stage 1 pressure sore to coccyx. It's right there. Patient verbalizes pain to sight, 4 out of 10. Here's my local pain right here. Patient reports pain, 4 out of 10. And then it's secondary to accepted condition disease process, malignant neoplasm of the rectum. My plan, I have one goal. Patient reports any altered sensation or pain at site of tissue impairment. My interventions, I have 2 interventions here. Assess patient's nutritional status. Inadequate nutritional intake places the patient at risk for skin breakdown and compromises healing. Assess site of impaired tissue integrity and its condition. Redness, swelling, pain, burning, and itching are indications of inflammation and the body's immune system responds to localized tissue trauma. And my evaluation. Skilled nurse provided perianal care after a patient had an episode of incontinence. Skin assessment performed by skilled nurse. Stage 1 pressure sore noted to coccyx. No inflammation or tearing noted. Patient does not report itching to site. Skilled nurse provided education and teaching on importance of having a high protein, high calorie diet to promote wound healing. Skilled nurse assisted patient in position change. Patient reports pain now 1 out of 10. Skilled nurse will continue to monitor site for any changes. Here I stated what interventions I performed in the patient outcome. I also matched my interventions to my interventions section. Now, if you chose an impaired tissue integrity nursing diagnosis and did this as your Soapie, but you did not state any education or skin assessment in your evaluation, and you only said that you provided incontinence care, your Soapie note will be sent back to you, because incontinence care is something that a CNA or a home health aide can do. You need to state in here what you did as a skilled nurse to provide education or provide skin assessment care as a skilled nurse. I'm going to go over one more Soapie note because I think it's really important. It's about when you are administering medications. So we're going to do one more. So this will be my second one. I'm administering breakfast medications, morning medications. So it'll be from 9 to 11. And so this can either be patient states, is it time for my meds yet? Or you can state skilled nurse administering morning medications. Either one is fine. or whatever the patient asks about his medications. So objective eligibility, I'm going to insert a new template in here. And if you type in medication, it'll bring you to ineffective management of therapeutic regimen, medication objective data. So you're going to select this and insert it to your eligibility. And then you're going to double click it and delete what doesn't pertain to your patient. So choices of daily living ineffective for meeting goals of treatment or prescription program, increased illness, verbalized desire to manage illness, verbalized difficulty with prescribed regimen, verbalization by patient that he or she did not follow prescribed regimen. So you're going to delete what does not pertain to your patient. So I'm just going to pretend for my patient that these 4 objective data pertain to my patient. So I'm going to insert it to my form. There's my objective data. Assessment prognosis, same thing. Go over here and type in medication. It'll pop up. And then I'm going to insert this to my template. And then I'm going to double click it. And I am going to go through it and change it just how I did for the other Soapie Note examples. So ineffective management of therapeutic regimen, medication related to complexity of healthcare, complexity of therapeutic regimen, decisional conflicts, economic difficulties, excessive demands made on individual family conflict, family patterns of healthcare, inadequate number of types of cues to action, knowledge deficit of prescribed regimen, perceived seriousness, perceived susceptibility, perceived barriers, social support deficits, perceived powerlessness. So these are all things that could pertain to your patient. But you need to only pick what pertains to your patient only. So I'm going to select a few that pertain to my patient. Okay. As evidenced by 1 to 2 of my objective data, or this can be something that the patient states. Sometimes you don't even have to have that as evidenced by, or you can state patient requires skilled nurse to administer medications. Secondary to accepted condition disease process. Whatever his condition disease process was, I think it was malignant carcinoid tumor, yeah, of the bronchus and lung. So you would put that there. Okay, so ineffective management of therapeutic regimen, medication related to complexity of healthcare, complexity of therapeutic regimen, knowledge deficit of prescribed regimen, perceived powerlessness as evidenced by patient requires skilled nurse to administer medications, secondary to accepted condition disease process. You can also in here put as evidenced by, if your patient was stating, is it time for my meds yet? If it's the wrong time for medications, because then that would be a knowledge deficit of the prescribed regimen. So I'm going to insert this to my form. Now I'm going to choose a goal. So it needs to match the ineffective management diagnosis. Do not choose skilled nurse medication management goals. That is not the same nursing diagnosis. This is. So I'm going to insert it to my goals. And if you click it and open it, there's 3 goals in here. So you only need to choose one. So describes intention to follow prescribed regimen, describes or demonstrates required competencies. So I'm going to choose this goal. Interventions, medication, ineffective management of therapeutic regimen, medication interventions, and rationales, not skilled nurse medication management interventions. Okay, so here's all the interventions for medication regimen. So you only need 1 to 2. So I'm going to administer medications per MD order, and I'm also going to assess for adverse reactions. So I'm going to insert those, and they're already blue highlighted, so I'm going to insert to form. My evaluation. So this is going to be short and sweet because you don't need a lot for your evaluation, because you are, as a skilled nurse, administering medications, and only a skilled nurse can do that. A CNA or home health aide cannot administer medications. So I'm going to put skilled nurse administered morning medications per MD order. Patient able to, you could put patient able to swallow medications without difficulty. You know, if they have dysphagia or, you know, impaired swallowing, you could put that. If not, you don't have to put that. You can state their vital signs. You know, if you took their vital signs before administering their meds. So BP 120/80, heart rate 76, respiratory rate 17, O2 sat 99%, on room air, and temperature was 97.7 Fahrenheit. And then skilled nurse will continue to monitor for adverse reactions to medications, because that is part of one of my interventions. I'm going to be monitoring for adverse effects of the medications. And that's all you need for your evaluation. And if you're done with it, you can hit send to office.